Good evening, my name is Kat, and today we'll be doing a cranial nerve exam. Now, before we begin, how familiar are you with these exams? I see, very good. So as you most likely know, there are the main three functions of the cranial nerve, which is the motor function, sensory function, and the reflex function. We'll be going through each of the three, just ensuring that everything is working properly. Now, the first one we'll be covering is the sensory functions, which include your hearing, pupil dilation, facial nerve, and sense of smell. To begin with, I'll be very lightly just feeling around your ears to begin with. I just want to ensure that there is no debris or there's no dust or any particles that may be stuck in your ear just before we begin this exam. Very good. And just to confirm, have you noticed any loss of hearing, loss of overall ability to hear, oversensitivity? I see, very good. Now I will be very gently just snapping my fingers like this on either side of your ears, just to ensure that you can hear and differentiate which side I am snapping on. So with your eyes closed, please. Just with them closed. Yes, thank you. Please tell me which side I'm snapping on. Very good. Very good. Thank you for that. Seems like you're able to differentiate where the sound is coming from, which is quite good. Moving on, I'm just going to very quickly just look in your ears. So with this tool here, I'll be very gently just pushing it into your ear just to ensure that there is no inflammation, any issues with the overall eardrum, and that the hairs in your ear are properly there. So just looking over here, please. I'm just going to look in your right side. Very good. Yes, we mainly do this just to ensure that the overall eardrum is not ruptured, that there is no issues in the ear, as we can, it's quite typical just to have a damaged eardrum if you go to concerts often, if you mainly don't wear hearing protection whenever you're around loud sounds for extended exposures of time, which in this current day is quite often. Now, I do want to see, when you are cleaning your ears, do you use a Q-tip? Do you use an ear scraper? Do you not? I see, yes. Because in both your ears, there is a very tiny amount of buildup, which isn't a major concern. However, if you are using a Q-tip, that is just pushing the earwax deeper into the ear canal, which can cause damage later on, which we don't ideally want because it can cause many problems for you in the long run. We recommend, if you are going to do it, just use a very gentle ear scraper, which you can gently go around and just in the outer section of your ear, not entering the ear canal, just on the very outer part, ensuring that there's not a buildup of earwax or anything like that. Yes. Now moving on just to your visionary test, just going to mainly just ensure that you're able to have proper pupil dilation. We'll be going on to eye movement later with the motor functions, so we'll be testing if your pupils are dilating as they ideally should. To begin with, I will be very, very lightly shining a light into your eyes just to ensure it is working properly. Please look at my fingers over here. Very good. I'm going to shine a light down. Very good. Perfect. Now it's on the other side. Look at my fingers. And we'll also go over this one more time. It's horizontal. Very good. Now I'll be very lightly covering your eye with the stick. We'll be doing one at a time. Look at the first one right here. There we go. I just want to see just if I cover it for a very slight period of time, how large the pupil will get and how much it does expand over the experience of the dark period. This is kind of a opposite compared to the light test. Just ensuring that your eyelid, your pupil is properly expanding. Very good. Let's go on now for the other eye. Yeah, so it's once again, it's mainly just focusing on ensuring that the pupil is properly expanding. If it isn't, there could be a numerad of issues. However, you do seem fine. Not too much of a concern here. Now, before we move on to the next little test, have you noticed any lack of sense, lack of smell, any issues like that? I see. So it will be a very quick exam, as it is a very quick test. So I have this little bottle right over here. I'd like you to breathe in. And what does that smell like to you? Like sea salt, correct? We have one more. Vanilla, very good. Thankfully, it doesn't seem like you have any issues just with your smell. Can you just look up for me? I'm just going to look a little bit into your nasal cavity just to ensure there is no major blockages, any issues with that. I'm going to hold your nose up kind of very gently, kind of very dimly. Very good. A possible concern we may have is a little bit of a buildup of blood, which can be due to the current winter weather, especially if you are living in a drier climate, typically year-round. However, it is not too much of a worry, and we will not have that too high on our little checklist here. Now moving on to the last little test for our sensory functions, we do have just the facial nerve itself. So I have two little objects here. So we have this little clip, and the bottom side is just a little sharp, not too sharp, just enough that if I very lightly press down on your face, you'll be able to feel a little bit of a pressure. And then on the other hand, I have this little wooden spoon here, which I will be very lightly just tapping on your face. I would just like you to tell me if it is sharp or dull. So obviously the sharp would be the little clip, and the dull would be the back of the spoon. Very good. So with your eyes closed, let me tell me if it is sharp or dull. Dull, correct. Dull, very good. Sharp, yes. Sharp, good. Very good, sharp. Now, during any of that, did you experience a excess amount of pain, any overall issues with your feeling, and a sharp increase in sensitivity? I guess that's very good to hear. Typically, if individuals experience a increased sensitivity, high amount of pain, it can be due to a few reasons. If your skin turns very red just after a light bit of pressure, it could be, as I believe it is called, dermagraphing, or is it a very mild and common appearance that if you trace your skin very lightly, it is still very light lines that will appear. However, I believe there's a better term for that. I'm maybe getting that just the name of it confused. Moving on to our next little test though. Just since you do seem fine with your overall sensation, I'm just going to very lightly just feel along your face just to ensure that there is no issues. So I'll just be going over your nose here. Please tell me if, as I apply any pressure, if there's any pain, if there is any overall sensitive spots. It's mainly just to ensure that there is no issues with any of the responding nerves. If anything feels numb, as if you cannot feel or notice the touch, please do let me know. Very good. Now, as we move on to our motor functions, we will be doing a little bit of a face focus test. To begin with, I'll get you to open your mouth very wide for me. Very good. And I'll just wiggle your tongue around. We'll go over to the left side over here. Good. And I'll just on to the right over here. Perfect. And now I'm just going to put this little stick down on your tongue here. And I would like you to say, ah. Very good. Good. Perfect. And once again, I'll get you to keep your mouth open and try to get your tip of your tongue to the roof of your mouth. This is mainly testing if you are tongue-tied, if there is any concerns with your overall tongue muscle. Very good. Okay, now put your tongue back down. And once again with the stick, I'll be very lightly pressing down. And as I press down, I'll get you to lift your tongue up and try to resist. Very good. Now, in a very similar way, I'm just going to get you to puff out your cheeks, as in holding your breath, and just keep your cheeks very puffed out. I'm just going to very lightly press in for the pressure just to get rid of that air. This allows me to ensure that there is no issues with the overall pressure and spatial gravity of your mouth. Hold still. Very good. Perfect. As our last little test for the mouth, I'm just going to look at your gums to ensure there is no issues and there is no recession occurring. It's going to be a very, very quick exam. Very good. And you have not noticed any mouth pain, sensitivity, tenderness when having sweets, cold foods, hot food. Okay, that's very good to hear. Now, as we move on, just to the facial muscles, my apologies. I'll get you to raise your eyebrows up. Okay, and as you have them up, I'm going to press down very lightly. Please resist. Good. And we'll do that one more time. Perfect. And in a similar fashion, I'll get you to try to frown. Keep your eyebrows down. I'm going to try to push them up. Good. And one more time. Doesn't seem to have any issues with that. Now, mainly for your last little muscle we'll test for your face, I'll get you to smile very wide for me. Good. I'm just going to pinch your cheeks a little bit. Now, is it painful to keep the smile wide? I see. Now frown. Do you feel any tension in your lower jaw when you frown or smile? Okay, very good. And now we'll very quickly move on to the eye movement, which will be our last little exam for the motor functions. Very good. Now we'll very quickly just be moving over to your eye movement. For the eye movement, I would like you just to look right at my nose. Just look at my nose. I just want you to tell me when you're looking only at my nose, when my fingers leave your peripheral vision. Very good. Perfect. Now for each individual eye, I will cover one eye just very lightly. And please tell me when the popsicle stick is getting closer, just until you can no longer focus on it. Very good. I'll switch over to the other eye. And once again, focus on the popsicle stick. Perfect. And now with both eyes open, I'm going to bring this right to your nose. Just focus on the tip of the popsicle stick. Perfect. And we'll just do this one more time. This is mainly just ensuring that your eyes are able to recognize an object close over your overall peripheral and depth perception. Perfect. You don't seem to have too many issues of that. There's a few instances where you may have a possible lazy eye, of eye drifting apart, eyes slightly not being as focused as we would like. However, just when I look at both your eyes together, it doesn't seem like an issue. You may be more left eye dominant, which isn't much of a difference than right eye dominant or both. It's quite common for just one eye to be a little stronger than the other, which is not a concern that we do look at. Now just for eye movement one more time, I'm just going to get you to look up here, this corner up here. Just going to look at your eyes a little bit closer, just to ensure there is no issues of your sclera, which is the white part of your eye. Okay, now let's look up here. Thank you. And now I'm going to pull your eyelid down just very lightly, just to look at the bottoms of your eye and ensure that there is no major veins, vessels, or redness under your eyes, okay? Perfect. And now have you noticed any tenderness when I lightly press down on your eyes? Just mainly on the upper eyelid here. Is there any pain, any irritation, any uncomfort? My apologies. I see, okay. So now we'll be doing this little eye test. So I will drop this eye drop into your eye. So you gotta look up for me. Put one in. Very good. And now just for the other eye. And do not blink yet. Perfect. And now in 3, 2, 1, blink, blink, blink. Very good. And keep blinking for me. It does seem like there is not too much of a concern for the overall tear duct. Seems like it is still producing the tears and there is no blockage. Have you noticed any floaters in your eyes, any issues with redness or any soreness or tenderness, stinging? Okay, it does seem like your eyes are fine. So now lastly, we'll move on to your reflexes. For our last little main function and main exam that we do have. So for this, we'll be looking at your hands and arms specifically. For your arms, I'll get you to put them straight out, just as if you're putting your arms out for a hug, okay? So put your arms straight out. I'm going to very lightly push down on your arms. Very good. In a similar sense, if you keep your arms straight for me, I'm going to be pushing up. Very good. Now, when I very lightly just tap your elbow with this hammer, I'm going to test for the reflexes. We may have to use a few times just to ensure we get the proper spot. Hold still. Very good. Perfect. Should be in the time zone. Perfect. So it does seem like your overall reflex for your arms are in the time frame that we ideally do look at. Just for this very slight twitch or bend in your arm when it is hit. Typically, these are your main spots like your elbows, knees, that you will most likely notice it in. However, it does seem fine for that. And now if you just give me your hands, please. For each of your hand, I'm just going to very lightly press down. Just ensuring the joints are very good, no issues and gaps. Perfect. And now, do either your hands feel too warm, too cold? If you consider it ideal. I see, okay. And I'm going to very lightly try to crack your knuckles and just get rid of any excess air bubbles in here. Okay, you do seem all good in that. Now, just before we do end this little session, I will be mainly just taking your vitals very quickly, which will just be your heart rate, just so we can have it on file, just to ensure there is no issues with overall heart tremors, heart issues, heart palpitations. Yes, just allows us to ensure that there is nothing that we haven't covered yet. Just mainly for our file, yes. Okay, perfect. Let's get you to hold still for me. Breathe like normal. Do not breathe in more than you normally would. Do not hold your breath. Seems quite good. Do you have a family history of any heart issues or any overall nerve issues? I see, very good. Well then, you should be all good. Head out. I'll add this all down to your file. Do you have any worries, questions, concerns for me? I see. Well, thank you for coming in. I enjoyed our little session tonight. And moving forward, you should not have to take a cranial nerve exam for a good couple days now. Because we've covered the main little bit, it's not a worry to have it on file for a bit. I know just before you do head out, when you do head to the front, the receptionist at the front will have you print off copy of everything that we did discuss today, any concerns, worries, and overall just how you as a patient are doing on your charts. there would be more information for your main vitals, such as your weight, height, BMI, and such on. However, you should be all good to head out. Bye bye now.